So one of our most popular surgeries that we do here at New Life Cosmetic Surgery is liposuction. And liposuction is just such a transforming surgery, and we love to do it. But as they say, 80% of results are surgeon dependent, and up to 20% is the patient taking good care of themselves afterwards. So during the post-operative time, there's a few things that I just want to touch on. It's very, very important that you stay hydrated. When we do liposuction, we're removing fatty tissue, and fatty tissue contains a lot of water. And so you're actually losing a lot of your own water during the liposuction procedure. And if you don't hydrate yourself afterwards, you can become very dehydrated, you become dizzy, you can feel weak, you can even pass out. So we really want you to drink up to 1 gallon of fluids the next day, and actually do that for a few days afterwards. So number 1, stay super hydrated. Number 2 is compression. We really need you to be wearing a good compression. We always put our patients in a stage 1 compression, that's a loose compression, during the first week. Sometimes you can go immediately to a stage 2 compression, and we'll talk to you about that. But wearing compression garment is absolutely vital. If a patient's not gonna wear a compression garment after the surgery, they're just not gonna get the results that they need. The next thing that we want for patients to do is to wear compression, both foam boards on the sides or foam cushions, and boards either in the front or the back, or maybe both. And we'll give you recommendations on that and where you can get those products, but it's super important for your results to have compression on your skin in the area that we lipoed to help with the contouring. The next thing is massage therapy. We highly recommend that you start getting massage therapy even the day after surgery if you can tolerate it. Massage therapy is going to decrease inflammation, it's going to get rid of all the excessive water that's built up, and it's going to help with your contours and speed up your healing. And so we highly, highly, highly recommend. It's a small investment for the amount of money that you're spending for this surgery. And so yes, it is going to cost a few $100s to get. I recommend anywhere from 6 to 10 massage treatments. Preferably lymphatic massage treatments are the best, but if you can get massage treatments that are done soon after, within the first week, start getting them done, and then do 2 to 3 for the next 3 to 5 weeks afterwards, you're gonna get the best results. The next thing that's super important is, it's always a concern for a patient, is the fluid that's leaking out after the surgery. I'll tell you that it's normal. So we get calls quite often where people can't imagine how much fluid is coming out. So we might decide to place small little drains in the incision. Sometimes those drains have a little bulb on it that collect the fluid. Sometimes the drains just open up that allow for the fluid to leak out on its own. Whenever you do liposuction, you've got to fill up that fatty tissue with fluid before you remove the fat. And there's always going to be some retention of fluid or fluid that's still around underneath your skin after the surgery. And that fluid needs to either 1, get absorbed, which some gets absorbed, or 2, it needs to exit out of your incisions. And the majority of it exits out of the incisions. So when you go home, it's important for you to do a few things. Putting a clear plastic curtain over your couch or over your bedding will help prevent all that fluid from soaking into the mattress or to the foam cushion. The second thing is getting a lot of towels and putting towels down. It's absolutely vital to do this because you will stain and ruin your furniture or your bedding if you don't do this. We want all that fluid to come out. It's completely normal for that fluid to come out, but we want you also to be prepared for it. Now you will soak through your garments that we place you on. We prefer that you don't take them off immediately afterwards. If you feel like you're wet in those garments, we would just ask to keep them on until the next day before we see you. And the reason being is if you take off that garment at first, your blood pressure can lower and you can get very lightheaded and dizzy. And we kind of want to be there for the first time that we lower that garment. Now, if you have to have a bowel movement, that sometimes happens, then you need to bring down the garment. But all the garments that we do also use allows for both the men and the women to void through it. So if you have to urinate, you do not need to remove the garment. There's a little area that you can urinate through. And so that's often the question we get as well. So want to just make sure you guys understand that fluid coming out is completely normal. Be prepared for it. Put towels down in your car that you're being transported and on your bed and everywhere else that you're gonna be sleeping. Remember to not get dehydrated, so making sure you're drinking tons of fluid. Be eating a lot of protein. That's gonna help with your small incisions healing. And just get plenty of rest. You're gonna feel very tired the first few days after the surgery, but your stamina will improve, as well as I do want you to be walking immediately the next day after the surgery. Get up and start walking and making sure that you're getting movement. That will help prevent any blood clots and will help you heal faster.